Good afternoon, everybody. It's 12:03, so we'll go ahead and get started. My name is Stacy Wood. I am the Health and Human Services Public Information Officer. And today we have Sensale assisting us with simultaneous Spanish interpretation as well as American Sign Language interpretation. To get started, I want to acknowledge our city and county leadership here in the room with us today. And also our speakers, we have Dr. Jennifer Mullendore, Dr. William Hathaway, Fletcher Tove, and Tim Love on the agenda. And before Dr. Mullendore begins with her updates, I'm going to ask each of our speakers to come up and say and spell their names, and along with their titles as well. So for those of you calling in to the conference line, I know we have some media partners calling in. You should have that dial-in number and conference ID. I have asked today that you text directly to 828-775-1321 your questions during the Q&A session, and we will ensure that your questions get answered. Please do pay attention to the content delivered from the speakers so that we do not duplicate efforts in that respect. So at this point, I will have our speakers come up and say and spell their names and along with their job titles.
Dr. Jennifer Mullendore, Mullendore, Interim Health Director for Buncombe County.
Dr. William Hathaway, William William, Hathaway, Chief Medical Officer for Mission Health, HCA Healthcare, North Carolina Division.
Tim Love, Buncombe County Government, Intergovernmental Affairs, TIMLOVE, INTER-GOVERNMENTALAFFAIRS.
Fletcher Tove, Buncombe County Public Health Emergency Preparedness Coordinator, FLETCHERTOVE.
So Dr. Jennifer Mullendore, I'm going to give an update. So at this time, there remains only one known case of COVID-19 associated with Buncombe County. However, the case count continues to increase across North Carolina. As of 11 o'clock today, the state website says that there are 63 cases in North Carolina. And per the state, all have had travel outside of the state or contact with a known case. And while at this time we do not have documentation of a case of COVID-19 in North Carolina that lacks any travel history or known contact with a case, we do expect that there is community transmission occurring in North Carolina, and we should all act accordingly. And to give you an update on testing that has been conducted within Buncombe County, as of 6 p.m. yesterday, our communicable disease staff have personally tested 12 individuals for COVID-19. 6 of those tests are currently pending. We have had 157 reports of tests conducted by local healthcare providers. And at our community specimen collection sites yesterday, we conducted 90 tests. That brings a total of just under 260 tests collected on individuals in Buncombe County. And we expect that as testing has increased locally and across the state, we will continue to identify additional cases. I'm going to turn it over to Fletcher now, or to Dr. Hathaway, excuse me.
Thank you. Dr. Hathaway, Bill Hathaway, I'm the Chief Medical Officer at Mission Health. A couple of updates for us today, which I think are important. We've been getting a fair number of questions that I wanted to address both through our social media and other platforms. First and foremost, as Dr. Mullendore pointed out, we have no cases at Mission. I think that's important to say, and no cases in our surrounding hospitals. We have many patients under investigation. Remember that when we do a test on a patient, they become a PUI, or person under investigation. That number rises. We then rule them in as a positive patient based on the lab testing, or out depending on that. We frankly have had a little bit of delay on the lab testing. It's still taking 3 to 4 days for the test to come back. So I anticipate that over the next few days we'll get many more negative results. Of those 260 plus cases that Dr. Mullendore referred to, we probably have about half of those within our health system, a little bit less than half, that have come through, many through the emergency department or through our MyCareNow testing sites. Because we have a case in Western North Carolina, albeit only one, and in Macon County, we have changed our visitor restrictions in our facilities. We have 3 different levels of visitation. Level 1 was what you were experiencing previously, which was screens at the door. Level 2 will be an additional level of restrictions predominantly related to the number of people who can visit patients in certain circumstances. We hope and ask that you appreciate why we're doing this, is to prevent spread to our healthcare workers and our patients in the hospital so that we can continue to provide the services that you need. We've been getting a lot of questions about elective surgeries. There's been, as you probably are well aware, a request by the Surgeon General to consider the reduction or elimination of elective surgeries. We are actively discussing that in the health system. This is a difficult question for us because the definition of an elective surgery by most people is one that is simply scheduled rather than an emergency. And it is our opinion that not all scheduled surgeries are something that can be delayed. The classic example is the woman who gets a mammogram and has an abnormal mammogram in need of a breast biopsy. While that is scheduled and elective, it certainly wouldn't be something that we would want to delay unnecessarily. So the simple decision to cancel a surgery because it's labeled elective is not easy. Our approach has been to weigh the balance between treating those patients now who are in need of these procedures and giving them the care that they need so we don't delay and then incur unnecessary problems for them later, weighing that against the risk of using resources that might be needed later. It is a difficult decision and one that we're weighing every day based on the utilization of resources and the availability of resources. It's our opinion at this point in time that the window is open to continue to provide many of these services, but we're looking at it on a case-by-case basis because we don't know when the wave hits us whether we'll be able to provide any of those services. So while this window is open, we're being very, very thoughtful on a case-by-case basis about how we approach this. As that changes, we will provide updates.
Good afternoon. My name is Fletcher Tove. I'm the Buncombe County Public Health Emergency Preparedness Coordinator. I'm going to speak at length today about the practicalities of social distancing. Social distancing, I'm sure you're all hearing a lot in the news recently. It's so important because it's a simple step that every single one of us can take to prevent exposure and minimize risk, and it's the best tool we have right now to slow the spread of COVID-19. So social distancing is not the same as self-quarantine or isolation, 2 other practices being utilized to minimize the coronavirus spread. The key difference is that quarantine and isolation restrict the movement of people to a certain area or zone to limit transferring and spreading an infection. Social distancing places no such constraint on location. Rather, it is a behavioral practice to lower risk in most circumstances. As Americans and people around the world are being asked to help halt the spread of COVID-19, we have frequently been told to practice social distancing. The idea is to flatten the curve or to slow the spread of the virus decreasing the number of people who get sick at one time and that risk of overwhelming our medical systems. In practice, social distancing means avoiding close contact with people who do we not live with, and also public spaces where surfaces may be contaminated. But no matter how often we have been given such advice, it may be hard to totally change our habits or to interpret this specific advice about what can be our best behavior. And the fact is that there is an incredible need for speed for social distancing for everyone. We need to do it now, and we need to continue doing that for the foreseeable future. Every single reduction in the number of contacts you have per day with the relatives, friends, coworkers, schools will have a significant impact on the ability of the virus to spread in the community. The key is we don't interact with people outside of our home units. And in some cases, particularly if we have high risk or vulnerable people in our families and homes, we'll have to practice social distancing with them as well. We know that social distancing is tough, especially with a young family or your young people who are used to gathering in groups, or with people who have high-risk people involved in their immediate communities or households. But cutting down on the number of gatherings and the number of people in any group will help. For older folks, the federal government is urging anyone with serious underlying health conditions and over the age of 65, and some of those health conditions may include lung and heart conditions and weakened immune systems, to stay home and stay away from other people, because data shows that these groups are the most vulnerable for developing a severe form of COVID-19. And this may include your own grandparents and family members, grandchildren. Visitors should stay away from nursing homes, retirement homes, and other long-term care facilities unless they're going to provide critical assistance. We understand this is tough and difficult because social isolation is already a problem for the elderly. Whether it's a FaceTime call, Skype, streaming movies that you can all watch together, virtually, at all costs, we need to try to separate those most at risk, 65 and older, from our day-to-day lives. For children, we do not advise that children get together for playdates or sleepovers with school being out. This is not a vacation. This is a specific step to prevent exposure for those children who may be transmitting that disease to our communities. This doesn't mean you can't let your kids play outside, but we want to, as much as possible, make sure we're maintaining them, 6 feet for extended periods of time over 10 minutes. And for everyone as individuals, again, it's okay to go outdoors for fresh air and exercise, to go walk your dog, to go for a hike, ride your bicycle. You don't have to remain indoors, but we want to avoid being in close contact with other people as much as possible. And again, that's within 6 feet for extended periods of time, particularly over 10 minutes. You may also have the need to leave the house for medicines or other essential resources, but please try to take steps to keep yourself safe during these excursions and maintain your social distance. When you leave home, wipe down any surfaces you may come in contact with. Disinfect your hands with alcohol-based sanitizer and avoid touching your face. And above all, continue washing your hands correctly and with frequency, especially whenever you come home from outside, before you eat, and before your contact with the very old or very young. This is about risk mitigation, and it's a community effort, and every single one of us can take this simple step to protect the community. To increase social distancing in Buncombe County Public Health is drafting a local supplemental order to Governor Cooper's executive order limiting local restaurants for dining. This mandate will mandate the closure of venues where people can congregate in close proximity for extended periods of time. This local emergency order will apply to gyms, pools, spas, and other entertainment venues, which will be specified later. Thank you.
Good afternoon, Tim Love, Buncombe County. Today I'm going to speak a little bit about business continuity. We're all aware of the impacts of COVID-19 in our community, the impacts to public health, to our medical facilities, but also to our private sector. In particular, our employers and their employees. And so what we want to talk today, we want to recognize that our community is based on small businesses, retail establishments, includes bed and breakfasts, hotels, also includes large manufacturers, and all of these entities are being impacted by COVID-19. In order to support these entities, we've stood up a working group that meets daily. We're including many of our industry groups and representatives to, one, share guidance with them. This is a dynamic situation, as we're all aware, to make sure that they have the latest guidance, but also to assess input from them about what their needs are, what they're hearing in their communities. As two items that I'd like to share with you, over the past days, we've been pushing out through our website, buncombecounty.org, guidance for employees impacted by COVID-19. And this guidance reflects on what's currently in place. So what are the tools that folks can use that are impacted if they become unemployed, if they lose their job, things like that. Additionally, later today, we'll push out additional resources for employers. We pushed out guidance before, but we're going to update that guidance today in terms of what are specific employer resources that can be utilized as we go through this continued time. Something I'd like to stress is that during this time, our support services remain ready, willing, and able. When I talk about support services, there are many. I'll start with our economic services group within our Department of Health and Human Services. They continue to operate and are available to anyone seeking any support related to workforce, nutrition, things of that nature. Additionally, NC Works is sort of the one-stop shop to begin your unemployment insurance journey if necessary. Additionally, the Department of Employment Security. All of these folks are still in operation. They have physical facilities that are open, but additionally are available through online means as well as telephone. If you're uncertain how to get to these resources, they are available on the Buncombe County website. Further, if you're needing help navigating the system, we recommend that you reach out to 211. My final comment would be, as we think about this response, I also want to mention, if you're not aware, that our local utility providers, the internet providers, energy providers, have been making available on their website information about how they're handling disconnections of services, and in many cases are not during this difficult time. Thank you.
Is that okay? Do this from here. Okay. So do we have questions from the audience? Okay. And Max will come to you with the microphone.
Going back to what you were saying, Dr. Mullendore, do we have any updates as far as those 10 people who had those close contacts with that person in Macon County?
No updates from what I mentioned yesterday. Everybody's been informed and are taking appropriate steps.
And with those folks, do they then get tested and then wait for those results to come back? What is the process for them?
Tests for COVID-19 are only for individuals who develop symptoms of COVID-19. So if any of the close contacts of a case develop symptoms, then we would test.
Can you change that as far as who's getting tested? Only because it seems like there are a lot of folks that are asymptomatic that we do know have COVID-19. Not necessarily here, is what I'm saying, but across the board. I mean, we're hearing from the CDC saying that a lot of folks that are asymptomatic do have COVID-19. We've heard it in national media as well. So are we testing the right folks just because they don't have symptoms, or what does that process look like?
So based on what the current CDC and the State Department of Health and Human Services guidance is, testing should only be done in people who have symptoms. At this time, the role of people transmitting the virus before they develop symptoms is actually unknown. So again, I think that the guidance to test only people who have symptoms is appropriate.
So Dr. Mullender, you may want to stay up there. So I have a question. Can you talk about childcare? They are, let's see, they are still open and kids will be in close contact with each other. Grocery stores too. Thoughts about risk to employees at the checkout?
Okay, so child cares, the question had to do with concerns about child care centers. So I spoke about this yesterday. There is guidance that was put out Monday by the North Carolina Department of Health and Human Services. It's available on their website. It's interim guidance for child care centers. And basically, again, what I said was that at this time, the role that children play in transmitting COVID-19, the virus that causes COVID-19, is unknown. We do know that if they do become ill, they have milder symptoms. We also know that children who are cared for in child care centers are too young to take care of themselves. And we know that the parents of these children may include healthcare professionals who need to be taking care of patients in hospitals and clinics. They include first responders. They include public health professionals. And we also know that 40% of children in the United States, when they are not in school or in childcare, are taken care of by their grandparents. Grandparents who are often over the age of 65 or may have chronic medical conditions, which put them at high risk of serious illness with COVID-19. And so based on what we know and what we don't know, the current guidance is that if child care centers want to remain open, if the owners want to remain open, they can, and the local and state and federal public health agencies support that. There is guidance on how they should exclude high-risk employees and high-risk children. There's guidance on the monitoring that occurs in terms of checking the children for symptoms. There's guidance on cleaning and disinfection. And so I know that our local child carers are taking this information into consideration and doing the appropriate steps to keep everybody safe. The second question was grocery stores?
Grocery stores too. Thoughts about risk to employees, especially at the checkout?
So again, I mean, we need food, right? That's one of the reasons that grocery stores were excluded from the executive order. And so there's guidance, again, for these, there's guidance for these businesses about doing, again, everything they can to limit close contact, to allow for social distancing in these settings, and to continue with disinfection and cleaning processes. And I know that there have been changes in hours to enable them to address some of these mitigation strategies.
How soon can we, let me just make sure, okay, how soon can we expect to see the local supplemental orders put in place?
Like I said, we're currently drafting those, trying to determine to what extent those will apply. We will have a draft to county leadership later this week.
Because there will be concern, will these have any impact on grocery stores or liquor stores? That's the question.
So again, this supplemental order, this local emergency order, is focusing on places where people can meet that close contact criteria, being within 6 feet for extended periods of time, particularly over 10 minutes. Places like grocery stores and retails where people are coming in and out, exchanging, not lingering for more than 10 minutes within close proximity, don't necessarily always meet that close contact criteria. And we are working to specify what kind of facilities that will specify in this order.
And will that include hair salons and barber shops?
Potentially. Again, we are making that assessment right now as we draft the order.
What are grocery stores doing to keep food and supplies in stock?
So there is no interruption at this time to national supply lines of communication. We know if you go into the grocery store, you may see shelves empty, particularly specific items. That is not indicative of a disruption to national supply. That's a display of the local store losing their supplies because people are coming buying them. So those supply chains are still operating. Those will be replenished as they get their scheduled deliveries. I do want to point out that we need to be, people shouldn't be hoarding on supplies. You need to buy a quantity that's appropriate for your household, because what happens when you go out and you buy out a store on stock, think about the most vulnerable, think about the high risk, think about community members who don't have the resources to go out and stock up on things like that. They need to have those available to buy as they have the capacity and as their schedules allow them. So don't go out and buy out stores and hoard stuff you don't need. Buy responsibly, think about what's reasonable for your household, and just buy that. When you're buying everything out, you're kind of taking stuff away from other people who may not have the resources you do. This is a community effort. We need to be thinking of others, right? So have that in mind as you go shopping.
Are there enough masks at Mission Hospital for nurses?
At this point in time, we have no concerns about our supply for personal protective equipment for our staff. That is part of the equation that I addressed earlier, looking at future needs depending upon when the surge of patient hits us. But we have no concerns about that at this point in time. Adequate supplies all around.
And Stacy, we have a...
Okay.
It did, yeah. But you pretty much kind of just addressed it right there. But Fletcher, for you, earlier, if I understood you correctly, you were saying gyms, spas, pools, things like that were going to be closed. When is that going to take effect?
I don't have a timeline for you. We are drafting the guidance, the order right now, looking at CDC guidance, state guidance. We're also, as Buncombe County Public Health, we're making a determination of what's best for Buncombe County. So we're taking that guidance, but also determining the best steps we can take to protect our community. That's a process involved, and that's the process we're going through today. And we'll be pushing our decisions to leadership very shortly.
Is that something that will likely take place today, or are we talking about tomorrow or in the days after?
I don't have a timeline for you. It's a very involved process. We're having some difficult conversations. You know, there's a level of complexity in all this stuff. So we're working, have people assigned to create the best solution for Buncombe County to protect public health.
Brownie, for you, can you talk about the emergency funding that county commissioners approved last night?
Sure. So at the county commission meeting held yesterday evening, the county commission appropriated $500,000. These funds are being made available to the county manager and her department heads to address emerging needs in response to COVID-19. And we wanted to provide a level of flexibility for the manager because we won't always know, in light of the unusual and unique nature of this challenge, what some of the different needs might be. So we wanted to go ahead and make sure that resources are available to address things that are already in the works, as well as other things that might become identified needs between now and our next scheduled county commission meeting.
Does county commission have the ability to inject funds for local businesses specifically?
The county does have the authority to support different kinds of economic development projects, and we already do traditionally a lot of different things to support business expansions in the community, to make loans to small businesses or people who want to start a small business. So these are areas that the county has been involved in for a long, long time, even under normal circumstances. So yeah, it is an area that we have authority, and I think as this issue evolves, those will all be things that we're looking at to do, to think through what we can do to support local businesses in this unique period.
I know a lot of them are having to close or kind of work things out in order to keep their employees paid, in a sense. So I was wondering if there's anything specific that you can touch on that you guys are considering for those businesses?
I think at the commission level, we have not had a specific discussion about this yet. I know Tim Love and other people in the county and the city's economic development offices are thinking about these questions. Of course, this is all moving really fast, so just thinking about schools, public facilities, these kinds of decisions have been the real focus for the last week or so. But we know this is going to be with us for a while, and so in terms of strategies to help workforce and local businesses navigate this is going to be a focus going forward for sure.
I think I saw Deborah around the corner there. Can you weigh in on the city's response as well and what you're doing to try and help the local businesses?
We are doing the same thing, coordinating our efforts with the chamber, with any economic development group that we can, in particular the state. So we are, as Tim said, we are meeting daily, trying to gather as much information and whatever options that the federal government, state government, but locally we don't have a whole lot of options and resources.
Is there an amount that you can inject in, or that's not an option that you would have as a city?
We are considering that, but that's certainly one that our elected officials will have to weigh in on.
And just as a reminder for those calling in on the phone, the number is 775-1321, area code 828.
Dr. Hathaway, I know you'd mentioned that you do have supplies. I was just curious, how many respirators do you have?
So define respirator. Do you mean ventilator or respirator?
So we'll do both. Respirators, the mask, and then the actual ventilators. Is there a way to?
I don't have an exact number for you on the respirators, but tens of thousands. I can't give you a definitive number. With respect to the ventilators, that seems to be coming up frequently, so I'll address it. On an average day in our health system, we have between 20 and 35 patients who need a ventilator. We have capability in more than 60 to 70 rooms to put people on ventilators now, and we can expand that. We have in our health system over 84 ventilators at this point in time, and the capacity to increase in combination with resource from HCA Healthcare. So we have the ability to more than 3 times what we typically use for our ventilator supply. So I think if the public has concerns about that, I hope that those fears are allayed. I pray that we have an adequate stock. I hope that we're not surged to that degree, but certainly we seem to be in as good shape as we can be right now.
So there's a question coming in. I think we might have already addressed it. Should spas, nail salons, and hair salons close?
Yes, we've seen many of them in the community already close. A lot of businesses across the board are being proactive, taking this COVID-19 threat very seriously. The purpose of our supplemental order is to officially make that a mandate to protect the public safety. But yes, they should close, and as we said, many of them are already taking those steps.
You can stay up there, Fletch. This next one I think is probably for you. Any rumors or misinformation you are hearing from the public that you would like to address?
Yes, so one of the biggest challenges and threats is rumors and misinformation, particularly on social media. So if you have questions or you're hearing stuff on social media or any other source, if it is not coming locally from Buncombe County Public Health via Buncombe County official social media, it's a rumor. So Dr. Mullendor, our health director, is the one who's notified if we have positive cases. That will be pushed immediately, or not immediately, but as it comes down, it'll be pushed through official social media. So if you're not seeing it through buncombecounty.org, through a press release, through Buncombe County social media, through Facebook or Twitter, it's a rumor. And also, if you're sharing stuff that's not coming from sanctioned sources, whether that's the CDC, the North Carolina Department of Health and Human Services, you're doing a disservice to everyone. We need to be focusing on correct data and information from experts. So for national level news, cdc.gov. For state level, North Carolina Department of Health and Human Services and Governor Cooper's office directly, and locally, buncombecounty.org, specifically public health. And again, buncombecounty.org/BCReady is our COVID-19 response page.
Okay. Oh, okay. Here's one more. Could he clarify also news outlets citing those sources? I'm not sure I understand. News.
I think they're referring to news sharing information that's not vetted by experts.
Okay.
So I always appreciate news being here, and in the past I've welcomed you guys as allies and partners and part of our community response effort. Part of that is a responsibility as media to vet your sources, make sure we're sharing vetted sources from experts at all levels of government and health, and that we're not propagating and giving a platform to misinformation and anything of that nature. And we appreciate your help in that effort. Thank you.
Can you speak to any specific cyber threats that you're aware of related to COVID-19?
Yes. So as a nation, we've seen a dramatic increase in malware, phishing, and other kind of cyber attacks, preying on people's fear of COVID-19. So everybody needs to enhance their awareness, their situational awareness of phishing attempts, of attacks on their software infrastructure. We know people are specifically targeting at this time hospitals, healthcare employees, local governments. So this is a real threat. We can't afford, as government or any healthcare system, a cyber type attack that will lock up or impair our operations. So everyone needs to be aware of this threat. I know the Department of Homeland Security moved this up, prosecution of these types of attacks to a priority this week. So cyber attacks and cyber predatory practices preying on people's fears of COVID-19 have seen a dramatic increase. So again, as media partners, we ask you not to play into those fears, push accurate information. Thank you.
Okay, I'm not seeing any more questions, so we will conclude.
I've got one more.
Oh,
Sorry.
okay.
For Sheriff Miller, I know there was a lot of discussion yesterday after the announcement with Judge Hill, talking about with the inmate population. Can you give us an update on where we are with that? I think yesterday he'd said between 30 to 50 or so low-level offenders had been released, basically people who had missed court dates, things along those lines. Is that still happening, and where are you all at with that?
Yes, it is. And currently we have 362 people currently incarcerated. And each day we normally process approximately 70 people for us in and out, for us booking and releasing. So I'm not able to give you the exact numbers, but that's our process.
Okay, so this will conclude our community briefing for today. I want to, so our testing sites will be open from 2 to 6 p.m. today at UNCA and Biltmore Church, just as a reminder to the community. We ask that those who are not being tested for COVID-19 not come into the testing area and leave the staff to their important jobs of serving our community, and that applies to media as well. And at this point, we are done for the day, and we will change the format tomorrow. And we will be in touch with our media partners about what that format will look like. All right. Thank you for coming.